Good morning. Good morning and welcome to ASH 2024. How nice to be here again. Please take your seat. We would like to start. Also, a special welcome to our attendees all over the globe. Good morning, good evening, good afternoon, wherever you are. I am Moshe Mittelman. I'm from Tel Aviv, and I happen to be the chairman of the scientific board of MDS Foundation, which is the host of this symposium. And together with me, Dr. Casey O'Connell from the University of South California, who is co-chairing the symposium. To those of you who are still wondering, yes, you are right in the right place, absolutely. I know there are many competing symposia, but this is in Hall B, which means the best. So really, you are in the right place. How do I know? Because I know the agenda. Believe me, you will agree with me in 3 hours. So just one comment before I hand the mic. Don't forget, as my boss used to say, don't forget to turn on the cell phones on your way out. And with no further introductions, I would like to invite Dr. Steven Nimer, Chairman of MDS Foundation, to say a few words of warm welcome. Dr. Nimer.
Thank you, Moshe, and good morning, everyone. I have about 6 minutes or so to talk to you about the MDS Foundation. Before I do, let me say that for those of you in the room here, it's fantastic to see people so devoted to such a difficult disease, myelodysplastic syndromes, and seeing old friends. So good morning, everyone, and I hope we have time for some good discussion this morning. The MDS Foundation, let's see, there we go, is celebrating its 30-year anniversary. It's a global nonprofit advocacy organization that supports patients and their families, healthcare providers in addressing MDS and now the numerous related diseases. And our vision is that every MDS patient will benefit from our initiatives and our research as early as possible. So there is urgency in what we do. Our mission to support and educate patients, their communities, and healthcare providers, to contribute to innovative research in the field of MDS and its related continuum of diseases, to better diagnose, control, and ultimately cure these diseases. Our office is in Yardville, New Jersey, and I always invite people to come by. We would welcome you with open arms. It's a lovely small town, not so far from Philadelphia. The leadership is a dynamic leadership and has evolved over the years. We have a board of directors that meets regularly. Our executive director, Tracy Araka, really leads the organization from an operational and other points of view. We have several emeritus members, and we have a very robust medical and scientific advisory board that helps us determine the program for these meetings, for our international symposia, and for much of what we do, talking about and planning our agenda and projects. We also now have a development board that is to raise philanthropy for the foundation. Here are the staff, and in particular, I'd like to shout out Leah Harrison, who is the Senior Project Manager for Professional Education. And Leah and the team who are here put on these amazing meetings every year. So thank you, Leah, and all on the MDS Foundation. We also have a large international nurse leadership board, and Sandy Curtin, who's on our board, is the leader of that leadership board. Over the last 30 years, the MDS Foundation has hosted 17 international congresses, and Dr. Mittelman here this morning, by memory, could name the cities of all of these meetings, so you can quiz him later if you'd like. And we started having regional symposium in the off years. one in Brazil, then Israel. Uruguay was virtual, Chile, and most recently, Seishiogawa and Yasushi Miyazaki hosted a meeting in Kyoto, Japan. Want to do a save the date for everyone and to please register May 7th to May 10th in Rotterdam. It will be our 18th International Congress. It should be an amazing meeting, lots of unpublished information, and a chance also for trainees and those that are experts in the field to get together. We have a Centers of Excellence program that spans the globe. We have 198 Centers of Excellence, so please apply. One of you will become Site 200. 77 are in the United States, 121 outside, representing 38 countries. And this is a referral base for patients and family that are given a diagnosis of MDS and don't really know where to seek expert care. And so we have physicians and nurses volunteering their time. We have patient forums, a number of things. And if you'd like, please apply, and we would love to consider your institution for a Center of Excellence. We've had a Young Investigators Grants Program that was initiated in 2005. We've distributed about $750,000. And we have a new grant cycle that opens in January of 2025. The QR code, or visit our website for information. This is for junior investigators that have interesting ideas about solving basic or clinical questions. We accept translational and basic research proposals. At our last international meeting, we announced Kelly Bolton and Pedro Mura as Young Investigator Awards, one at WashU, the other in the Karolinska. And we look forward to reviewing some really incredible applications. We have, working with Spark Cures, a new MDS clinical trial matching platform. It helps identify for patients trials outside of their institution or for physicians. Really, we hope that this will save you time in dealing with patient questions and getting people onto trials. Of course, this is a pitch. We would like to have as many of you become members of the MDS Foundation. Student membership is $50, about the price of lunch today. And so professional members, $125. And we continue to provide increasing numbers of benefits to people who are our members. And at our meetings and other things, there's preferential treatment for MDS members. The MDS Foundation has supported a number of international working groups, the IWGPM, IWG Molecular, the MDS MPN IWG, and please reach out. We like to get as much involvement from the MDS community as possible to speed along these efforts. I condensed about 4 slides into one, the patient support and education. It's one of our greatest, most important assets. We have quality of life patient and family events. We have webinars. We've got the building blocks of hope, understanding MDS. We have videos and things in multiple languages. The building blocks of hope is in 14 different languages. So please use us as a resource, no matter where you are, to help educate your patients. This is an impossible disease for physicians who are not hematologists to understand, let alone our patients. We do a number of awareness efforts to raise awareness of the foundation. So we've had a series of walks. The first one was in 2018 in Boston. You can see where the others have been held. And all total, we've had 25 walks since 2018, and I'd like to thank all of the MDS experts in these various cities who lead the walk and make sure that things go well. So that was a brief presentation. We have to get to the meat of the program now. I thank you all for listening, And there's MDS Foundation staff right outside if you have any questions or you'd like to be a member. Thank you very much and enjoy the symposium.